come running up to me in the park, actually, and we tried to shoo her away and she wouldn't go away.
And you named her after
And
Veronica?
I named her after my one, after Veronica, yeah, one. You don't know that one, do you? Right?
Man's best friend is no substitute for his life partner, and Percy Lovett is still adjusting to life without his. Veronica Nelson died in a prison cell in 2020, naked, alone, and in pain.
No one should have to go through like that, through pain like that. You know, especially when you can see they're sick and they aren't lying. You know, when people ask for help, you do help.
Percy is now suing the prison healthcare provider Care Australasia, and the Victorian coroner has referred the company to the Director of Public Prosecutions. Were you surprised by what happened to Veronica Nelson?
No, not at all. Not at all.
We do have two areas to this building. This is a primary health and the other side's a subacute area.
The company, which holds over $700 million worth of Victorian government contracts, has managed to largely avoid the spotlight until now.
Victoria is unique in outsourcing all of the healthcare in public prisons to a private for-profit corporation.
Over the last 4 years, the Health Complaints Commissioner has received over 5,000 complaints by Victorian prisoners about the healthcare they've received while locked up, but they wouldn't specify how many of those relate to Correct Care. What we do know is in that same period, Correct Care has been criticised in 3 separate coronial inquests into deaths in custody, in addition to Veronica Nelson's.
What the inquest into Veronica's passing shows is that Correct Care Australasia and for-profit corporations are entirely unequipped to provide safe healthcare to people in prisons.
The Victorian Aboriginal Legal Service is now representing families in 3 upcoming inquests into prisoner deaths.
All of those coronial inquests involve medical care provided by Correct Care Australasia, and all of those coronial inquests will examine the quality of medical care provided by Correct Care Australasia.
Sarah Schwartz says the centre's clients have had ongoing issues with the care they've received in Victoria's prisons.
They tell us about really serious medical concerns like cancers, like strokes, which aren't dealt with as a matter of urgency.
A year after leaving prison, Ian Readers is now enjoying his freedom. He spent 6 months behind bars for breaching an intervention order.
I did not feel safe. I couldn't rely on them to give me my prescribed medications at the times that they were prescribed.
And you couldn't go anywhere else?
No, couldn't do anything about it. You could only go to Correct Care.
The 72-year-old says Correct Care Australasia's staff repeatedly refused to give him his medications for illnesses including depression, restless leg syndrome and urinary and faecal incontinence. He says at one point he went without sleep for 7 nights as a result.
At one point, about 3 or 4 o'clock in the morning, I said, look, I've fallen over 3 times. I'm afraid that the next time it happens, I'm going to crack my head on the concrete floor or something, and then you guys are going to be responsible. But they didn't care.
Today, WellPath employs more than 15,000 professionals at over 500 facilities in 34 states plus Australia.
Correct Care Australasia is owned by WellPath, the largest for-profit healthcare provider in correctional facilities in the United States. WellPath has its own troubled history.
What I keep seeing, and what all lawyers keep seeing, is the restriction of just refusing to hospitalize in order to save money.
Erica Grossman is an American lawyer who's represented prisoners and their families in more than 10 cases against WellPath.
It's prioritizing their own profits of the company over the people that they're supposed to be caring for. And then these very sick individuals die or get seriously injured because they just don't hospitalize for hours and hours, days and days. And often they die very, very gruesome deaths.
And you become an accomplice to evil.
Former nurse Crystal Tucker says she raised concerns about patient neglect and racial discrimination at a correctional facility in Tennessee.
Prison here is a business. It is a multi-billion-dollar industry. And any industry to stay relevant and profitable needs customers. And that is why I could not understand, why would you not take care of and keep your customers healthy?
She believes she was fired for speaking out and sued the company for wrongful termination, so she's limited in how much she can say. But she says prisoners' medical care was compromised for the sake of saving money.
The first thing that I needed to stress was that the people were there as punishment, not for punishment.
I would hope Australia could take a lesson from the United States and not continue this model that WellPath has of privatizing healthcare. It is not a good model. It doesn't work. And it just leads to serious injuries and deaths. And it's not going to stop because the entire model is money over care.
Former inmate Ian Readers believes he suffered as a result of that mentality here in Victoria.
Kick them out. I don't think they should have a role. They're just there to make money. They're not that concerned with the medical care.
In a statement, Correct Care Australasia denied there's a culture of cost-cutting. It says it has a commitment to its patients and is proud of its achievements. The Victorian government is not renewing Correct Care's lucrative contract, instead opting for another private provider, GEO Group. GEO told 7:30 it's invited all current Correct Care staff to join its healthcare team.
We have no faith that GEO Group, who is another for-profit prison company owned by a US company, will provide any different standard of healthcare in Victoria's prisons.
Correct Care is yet to file a defence in Percy Lovett's civil claim over the death of his partner Veronica. He hopes others behind bars will be treated with dignity and care when they get sick.
She just should have been looked after a lot better. All they had to do was their job, nothing else, and they couldn't even do that right.